This 3D wireframe facial model highlights the stomach, large intestine, and gallbladder meridians. In traditional Chinese medicine, we treat neuralgia through butong zitong. Where there is obstruction, there is pain. We identify blockages along these specific yang pathways. Since the face is the meeting place of all yang channels, a single universal prescription is ineffective. Resolving this requires a strict 3-step clinical strategy. Step 1 identifies the exact region. No wandering nature, cold trigger, and white coating identify this as a wind-cold obstruction. For patient A, we use distal points like SJ5, GB20, and LU7 to expel the wind. Because cold is the primary pathogen, the treatment requires mild warming or moxibustion to open the channels. Patient B presents with burning facial pain. Since burning sensations can stem from different internal sources, we must distinguish between 2 specific heat patterns. This flowchart shows the differentiation. Stomach fire involves the yang-ming channel and presents with swollen gums and a thick yellow tongue coating. Liver fire rising is often linked to stress, manifesting with red eyes and a wiry rapid pulse. The distal master points change depending on the path. Stomach fire requires ST44 to drain yang-ming heat, while liver fire requires LV2 to clear the channel and subdue the ascending yang. Applying moxibustion to these heat patterns inflames the collaterals and increases the patient's pain. Accurate pattern diagnosis must dictate the technique. In elderly or post-surgical patients, the pain is often chronic, fixed, and stabbing. It typically worsens at night and is accompanied by a purple or dark tongue. These symptoms indicate qi and blood stasis. For long-standing nerve compression, manual acupuncture alone is often insufficient to resolve the blockage. This schematic outlines an electroacupuncture protocol for stasis. Pairing points like ST6 to ST7 locally and LI4 to ST44 distally at a low-frequency or dense dispersed setting helps open the collaterals. Look at this clinical challenge panel. The patient has stabbing pain in the right cheek that worsens at night with a dark tongue. Pause the video, identify the TCM pattern, and name the 2 distal points used to invigorate the blood. The fixed pain and dark tongue indicate blood stasis. The required distal points are SP10 and BL17. Chronic structural pain requires points that birth apart physical collateral stagnation, rather than just regulating the channel. Mixed presentations are common. A patient might have burning maxillary pain that is triggered whenever they feel a burst of anger. This combines yang-ming heat and liver fire. The prescription uses ST7 and SI18 locally, with LI4, ST44, LV2, and GB20 as distal points, using a reducing technique. This matrix table maps every discussed symptom to its respective TCM pattern, points, and required technique. Take a screenshot of this table to use as a reference guide in your clinic. You must also recognize these clinical red flags: progressive facial numbness, muscle weakness, sudden vision changes, or suspected tumors.